So I'm just going to introduce our presenter for tonight. This is Melissa Mendez, Dr. Melissa Mendez. She specializes in the comprehensive management of erectile dysfunction, and she sees patients in the Silver Spring office. She's going to be presenting tonight on erectile dysfunction, preventative care, and treatment options. And at the end of the presentation, we'll be opening it up for questions and answers. So feel free to send any questions that you have through the email that was provided. And also you can type your messages into the chat and we'll hopefully get to all of your questions at the end. So with that, I will turn it over to Dr. Mendez.
Great. Thank you so much, Lisa. Well, thank you everyone for joining us tonight. Tonight's discussion, this is going to be the first of a series of webinars that United Urology is hosting. So we're going to be talking about what is erectile dysfunction, what are some of the causes, what are some of the treatment options that we have both in terms of preventative care and active treatment options. And so we're going to be going over all of those things tonight. In the webinar series, we have a couple more presentations coming up over the next couple weeks. I know next week we have Dr. Aisha Taylor talking about UTI treatment and management. So that's going to be on April 28th. And then Dr. Dave Fenig is going to be talking about treatment options for low testosterone. So that may be of interest to some of you gentlemen out there. So that's going to be on April 29th. So just kind of keep an eye on the Chesapeake website. On Facebook is a good place to get some of this information. You can be aware and you can share that information with family and friends if you know that they're suffering from some of these urological conditions. So without further ado, we'll get started here tonight on our topic. Appropriately, is erectile dysfunction causing social distancing at home? We're going to discuss, like I mentioned, the preventative care options and active treatment options that exist for treating erectile dysfunction. I am Dr. Mendez. I work in the Silver Spring location up in kind of the Wheaton, Aspen Hills area. If any of you guys are familiar with Leisure World, it's in that general vicinity. And my background is I trained at Duke Hospital for my surgical training, and then I specialized in additional training specifically in sexual medicine. So I look at all aspects of sexual medicine, the comprehensive management of erectile dysfunction. So not just pushing pills or pushing surgeries or anything else, but really looking at the whole person to figure out, number one, are we doing everything that we can to keep your health safe and secure? How do we get the best outcomes for managing your erectile dysfunction? And what are some things that we can do to get you to your goals, which are individual to each man? Everyone has different preferences, different goals, and so that's a big part of determining your care pathway. Other areas that I specialize in is looking at erectile recovery and penile length preservation protocols. This can be particularly pertinent and important after gentlemen have undergone treatment for prostate cancer. Any type of surgery that's involved with men's genitalia is an area of specialty, and then Peyronie's disease or curvature of the penis is another area that I treat, and then men who leak urine with coughing, sneezing, lifting, things of that nature. We're going to talk about why does erectile dysfunction happen to some men and not others? What exactly is erectile dysfunction? Why does the tissues change? What happens to actually cause a change in function? And then what can be done about it? Most importantly is to know that you're not alone. There's 39 million American men with erectile dysfunction, and likely this is an underestimate as it's underreported by many men. We know that after the age of 40, 1 out of 2 guys will suffer from some degree of erectile dysfunction. So if you think about friends, family, people walking down the street, you know that the majority of folks are going to be having some degree of issue after the age of 40. And unfortunately, most men suffer in silence. 82% of gentlemen surveyed wanted the doctor to bring up the conversation. And 74% revealed that they were too embarrassed themselves to bring it up. And so this resulted in only 22% of men actually discussing the issue during an appointment. I think that there's a lot of gentlemen out there that might not have been able to bring this up in the past that can really benefit from both knowledge and treatment options in regarding to erectile dysfunction. So who's at risk? If we go back into the 1970s, it was widely believed that erectile dysfunction was caused simply by what was in your mind. It was a psychogenic diagnosis, meaning that it was in your head, it was just lack of interest, and that's why your erections weren't working the way you wanted to. And over the years and through a lot of research, we've realized that this just isn't true. And 80% of the time, there's an underlying physiological cause that is harming the erections, meaning that there's something going on with the body itself that's making the erections not function as well as they used to. For many men, this is a vascular issue. So of men with vascular disease, which would include high blood pressure, high cholesterol, heart disease, vascular disease, 65% of those gentlemen are going to have troubles with their erections. Whereas if we look at men with diabetes, over half of men with diabetes are going to have some troubles with their erections as well. And so this is a huge part of our population in the United States that deal with these medical conditions and therefore have more troubles with their erections because of it. There are other things that can cause troubles with the erections. So certain medications can cause troubles with the erections. Very commonly, high blood pressure pills, such as beta blockers, other antihypertensives, or diuretics, such as HCTZ or Lasix, can have some effect on the erections. But caveat, very important to treat the high blood pressure, because untreated high blood pressure over time can cause very severe damage to the erectile function. So you want to make sure you're taking the high blood pressure pills not only for your overall health and safety, but also for preservation of your long-term erectile function. Narcotic or pain pills can have a really significant negative effect on your performance and your erections. And as that has become more commonly prescribed, or a problem with pain pills out in the community, this is another thing that we're seeing a lot of, is that erectile dysfunction is being caused by opioids or these pain pills. SSRIs are depression or anxiety medications. These commonly are prescribed across the board, and they are very important for, again, treatment of depression or anxiety, but they can have some negative effect on the erectile function. And we can sometimes, working with your primary care or a psychiatrist, make changes to these SSRIs, and so you have less of a negative effect to the erections or orgasmic function. Antihistamines, allergy medications less commonly cause erectile dysfunction, but can cause some issues there. In itself, depression, anxiety, and increased stress increases what's called the sympathetic nervous system, and we're going to talk about this more in detail, which increasing the sympathetic system can decrease your erectile function. And so you can have a lot of issues with performance in the erectile function if you have any of these diagnoses. Smoking, so for each cigarette you smoke, you're going to have a constriction of your blood vessels for 7 hours after that cigarette. And so the penis is heavily dependent on blood flow for its function. And so you can start to see how smoking can have a really negative effect on erectile function. And over time, long periods of smoking damage the blood vessels, the very delicate vessels that are in the penis, and this can cause permanent erectile dysfunction. Heavy drinking, I think colloquially, we all realize that after a night of heavy drinking, there can be decreases in function. And so this is where we're seeing that. Peyronie's disease. As I mentioned, Peyronie's disease is the formation of scar tissue or plaque within the penis. It can start just out of the blue, or it can slowly develop over time. But as that curvature develops in the penis, and as that scar tissue develops in the penis, you may know that there's a change in your actual erectile function, either the firmness that you experience or the quality of that erection, or you may be able to achieve but not maintain, or sometimes the Peyronie's disease allows you to still have an erection, but the curvature is so severe that it makes it difficult to have intercourse. So that's a kind of a whole nother separate issue. Moving on to surgery. So gentlemen that have been diagnosed with prostate cancer are commonly treated with either prostatectomy or radiation, and both of these things can cause erectile dysfunction after treatment. It's about 50 to 90% of gentlemen after these treatment options will have some decrease in their function, and most will need to have some assistance in achieving their erectile goals after treatment for prostate cancer. So this is a really important group of men that need some special care and consideration from their physician in order to get them back to their goals for their sexual health. Trauma, if there's any injury to the penis or the blood vessels that feed the erection, that can cause dysfunction as well. What exactly is erectile dysfunction? It's the persistent inability to achieve or maintain an erection that's firm enough to have sexual intercourse. To better understand how things can go wrong, it's really easiest to start with understanding the normal process of an erection. The erection is controlled by two things. The blood flow, which is number one, the blood flow in helps with the firmness of the erection, and the blood staying in the penis is correlated to the maintenance of the erection. So then we start looking, well, what controls the blood flow? So the arterial supply is going to be the blood flow into the penis. Again, that has a lot to do with firmness of the erection. And then the veins allow the blood to return to the body. So this is going to, if the blood is returning to the body, you will not be able to maintain the erection. So if we have a lot of leakage of blood through the veins back to the body, you won't be able to maintain the erection. The nervous system controls the blood flow. So your nervous system says, okay, we're going to dilate the arteries, increase the blood flow to the penis. We're interested in having an erection. That causes the blood flow in. There's another part of the nervous system that says, you know what, now is not the time for an erection, and it constricts the blood vessels, and that makes it very difficult to achieve an erection. So here we have a schematic, just a simple cartoon drawing of the inside of the penis. This is kind of looking down the barrel of the gun, so to speak. So when we're thinking about what makes the penis firm for an erection, we have the corpora cavernosa. So that's actually what gets hard during the erection, and that's kind of the, if you kind of look at this and think of a face, that's the rim of the eyes here. And if you look at the pupil of the eye, that's your cavernosal artery. So that's your blood flow in. That's what provides the firmness to the erection. These little blue circles around the outside are the veins. That's what allows the blood flow to return to the body after the erection is complete, or in erectile dysfunction, if you're having troubles with maintenance, the blood flow can return too soon to the body through these vein channels. So during an active erection, the blood flows in through the cavernosal artery. The corpora cavernosa fills with blood and gets hard and firm. And it stays that way because it's compressing these veins on the side so that blood cannot return back to the body. The penis is firm and it's maintained in its erection until climax, which is then what sends the message to the nervous system. Then it's okay to release the blood flow and return it back to the body. So as we can see, the nervous system is extremely important in the function of the erectile system. So our parasympathetic system is our state of relaxation. This is a very old system in our bodies that has developed over, tens of thousands of years of evolution to say, if life is good, I can be relaxed, it's a good time to have sex, it facilitates blood flow and facilitates erections. Whereas if you think of the sympathetic nervous system, this is our fight or flight response system. So if you're getting chased by a bear, you're not in a good position to be having sex or have an erection. And so stress, anxiety, worry trigger the sympathetic nervous system. It constricts your blood vessels and it makes it very difficult, if not impossible, to achieve an erection. So if we kind of correlate that to settings where you might feel increased stress or anxiety in intimate setting, or if you're thinking, is my erection going to be there for me or not, and you start overthinking the erection, that in itself can make it more difficult to achieve an erection. So here we're looking at some of the actual mechanics of what helps control the blood flow into the penis and things that can hurt that. So atherosclerosis, which is the buildup of plaque within a blood vessel, limits the blood flow into those vessels and makes it more difficult to achieve an erection. This is going to be common for things like heart disease, elevated cholesterol, high blood pressure. Things that hurt the vessels are going to create this plaque buildup and decrease the blood flow. Diabetes also can cause this. And we look over to the screen on the left-hand side here, and we can see the effect that this decreasing blood flow has on the nerves. The nerves are also dependent on, their very delicate system of blood flow. And so once they start losing that, the nerves themselves die. And the nerves are what are associated with the sympathetic and parasympathetic system in terms of dilating and controlling the vessels, the larger vessels, and controlling that tissue. And so both of these systems are absolutely critical into the normal erectile function. And that's why things like vascular disease and diabetes can have such a negative effect on erections. So when we're thinking about gentlemen that are having troubles with their erections, it's really important to know if you have a history of diabetes, vascular disease, surgery, radiation, trauma, as you may not respond as well to traditional pills like Viagra or Cialis alone. And it's really important for you to find a sexual health specialist to help manage your sexual health goals, as you may need some more additional treatments, or at least know about treatment options that can better facilitate those goals. It's also, for your overall health, really important to understand that erectile dysfunction can be an early sign of heart disease. On average, if you have no other signs of heart disease, erectile dysfunction can show up 2 to 3 years in advance of a major cardiac issue, such as a stroke or an MI or a blood clot. So pay attention. This can be an early sign that your body's giving you. So if you're a young man less than 50 years old and you're having some trouble with the erections, see your primary care or your cardiologist for screening for any evidence of heart disease or vascular disease. It could save your life. Also, men with any strong family history of heart disease, stroke, or vascular disease should be talking with their primary care doctor or cardiologist particularly if you have early onset erectile dysfunction. There was actually a recent study that came out just 2 days ago, the European Men's Aging Study, which revealed that men with erectile dysfunction actually have an increased risk overall of death, independent of any of their other factors or health factors, including their testosterone levels. So we should be using this not only as an opportunity to improve our quality of life, but also to look at our overall health and make sure everything's tip-top. We've kind of gone very extensively over why does this happen, and now we're going to talk about what we can do about it. So I have a little saying, and if you come and see me in clinic, you'll probably hear me say it again, that whatever is good for your heart is good for your penis. And it's true in many respects, not only from the emotional standpoint, but also, from a physiological standpoint. Your heart is made up of big blood vessels, and your penis is made up and dependent on very fine vasculature, very smaller blood vessels. And so you need to help take care of these blood vessels. You can do that by keeping a healthy diet, limit your salt and your sugar. These two things, salt is going to increase your blood pressure. Sugar is going to increase your risk of diabetes. Limiting those two things in your diet can make a huge difference in your overall health. You want to watch your blood pressure and your cholesterol to make sure both of those stay in good control. Regular exercise helps not only with your overall heart health, but your tissue health. So the more you exercise, you're getting good blood flow to the tissues, you're getting good stretch on those tissues, particularly anything that's going to be cardiovascular, walking, running, any of those things are going to help increase your pelvic blood flow. Yoga is great, stretching, and that's going to be good for your tissues. We want to keep good blood flow, keep the tissue healthy, and the last thing is to use it or lose it. So you want to encourage the frequency of your erections best you can, and I'll go into a little bit further of how we can accomplish this. So looking at good blood flow. So like I said, you want to do regular exercise, maintain a good blood pressure, and then talk to your doctor. There are certain medications that we can prescribe that help increase blood flow specifically to the penile tissues. That helps facilitate good, strong erections and helps with maintenance. And then also increasing the blood flow is going to be using what's called a vacuum erectile device. And I'll go into this in a little bit further detail further in the talk. So we want to keep the tissues healthy. Very much like yoga for the rest of the body, we want to keep penile tissues flexible and healthy. This helps keep not only the length of the penis, but the girth of the penis, and allows for the penis to be able to expand with the erection, pinching off those vessels that would otherwise return the blood and help maintain the erection. And so we see in these little pictures on the side, these nice pink, fat, healthy cells. And as this blue squiggly lines develop, that's scar tissue. that's not as pliable, and that can cause constriction of the penile tissues, which can cause shrinkage of the penis and loss of erectile potential. So we call that scar tissue fibrosis. So fibrosis in the penis is not our friend, and it can cause a lot of problems. So we want to do everything that we can to keep those tissues healthy. Things that can cause fibrosis or this scar tissue develop include, surgery, any type of inflammatory process, radiation. If you've had erectile dysfunction for a long period of time, you're not getting that good blood flow to the penis. The tissues in the penis are, in a sense, almost like starving for that good blood flow, and so they develop this fibrosis or scar tissue, which is in turn what can lead to loss of function, loss of length, loss of girth. So the use it or lose it. The goal is to maintain the good penile health by achieving frequent erections. Now, many men come in to see me, and they have this conception that if they're using erectile pills like Cialis, Viagra, what have you, it means that they won't be able to have erections without it, or they will develop a dependency on it. So kind of to debunk this myth, number one, we don't have any evidence to suggest that there's any form of dependency physically with erectile pills, meaning that if you're taking a Viagra or Cialis, it's not going to cause your erectile health to go downhill over time. Actually, it does the opposite. By increasing that good blood flow to the penis, it can help not only the actual blood flow and healthy tissues, healthy nerves, give you a better erection, but it can help your confidence. And if we help your confidence, that you're going to have a firmer erection that's going to last, it helps quiet down that sympathetic nervous system, which in turn is going to help with the blood flow and help your erection further. So actually using erectile pills such as, the Viagra, Cialis, can actually help you in the long run achieve better natural erections by improving that blood flow, improving the confidence. Some men are actually even able to wean down their dose that they're taking or the frequency of which they're using these medications. So getting a little bit more in depth into the actual active treatment options that you'd want to speak with your doctor about. We're going to go through each of these in detail, but just to overview, we're going to be talking about pills, the vacuum erectile device, intraurethral suppository, ICI, which is short for intracavernosal injection therapy, and the penile implant. So the pills are the most common. This is going to be kind of the go-to first-line treatment for most gentlemen, as it's the least invasive, it's the easiest to try as a first-line therapy, and these are relatively safe medications. We'll talk about specific areas that you have to be knowledgeable about in terms of your own particular health or medications that you're also on, but otherwise, these are very well tolerated. So the way they work is by increasing the blood flow to the penis. So they basically cause what's called a vasodilation, a smooth muscle relaxant that allows more blood to flow into the penis when you've become stimulated. So it's not like you pop this pill and all of a sudden erection comes on its own. That's not the way these work. The way these work is you want to take it about an hour prior to sexual activity, ideally on an empty stomach, and then when you are to engage in your sexual activity, and this can be either with masturbation or partnered stimulation or intercourse, you still require that same interest, that same stimulation to achieve the erection that you otherwise would have. So these pills don't just pop an erection up, you have to have the same stimulation that you otherwise would have to get the erection to work. It's just that once you have done that stimulation, it increases the blood flow and it can increase the quality and durability of the erection that you achieve. So these pills are going to work anywhere from 4 hours to 36 hours. And so that just depends on which medication you're taking. Viagra is going to be somewhere in between the 4 to 8 hour range, whereas Cialis can stay in your system for up to a 36-hour time frame. And you don't want to take these more than once a day. So if you took your pill and it was, say you took a 50 milligram of Viagra and it did not work for you, you don't want to take a second pill in that same setting. You want to wait a 24-hour period, and then the next time, the maximum dose you would want to take for Viagra or sildenafil, which is the generic, would be 100 milligrams. And that's something to also check with your doctor about as well. But don't do multiple redosings within the same day. How effective are they? So it varies for men, and it really depends on what are your other health conditions. So gentlemen that have severe vascular disease or diabetes are going to have less of a chance that these pills are going to work well for them. But if you take everyone as a whole, it's going to range from about 50% to 85% of cases will have good response to these medications. Another important group of men to consider is gentlemen that have undergone either prostate surgery or prostate radiation, is they're more apt to give up on the pills as they're just not working well enough for them. And then men with diabetes, as I mentioned, are more likely to have to move on to other forms of treatment as the pills just aren't strong enough to help them to meet their sexual activity goals. So the most common side effects are going to be headache, facial flushing, which is just that redness, heat in your face, stuffy nose, and upset stomach. You want to talk to your doctor if sex is advisable. So if you have a heart condition, you do want to have clearance from either your primary or your cardiologist prior to engaging in sexual activity, as it can increase your risk for having a cardiovascular event if you're not used to strenuous activity. And then you cannot take Viagra, Cialis, or any of the ED medications if you are on a nitrate, which would be nitroglycerin or nitro-paste. So if you take that medication, you cannot take these pills. It causes a very unsafe drop in blood pressure, and gentlemen can die from that. You also want to talk to your doctor if you've ever had any heart problems, stroke, lower high blood pressures, or any kidney or liver problems prior to getting started on any new medications, and in particular these. So who does this work well for? So this is a great first-line treatment for most gentlemen, aside from those that we just discussed that would be on nitrate medications. So if you haven't tried treatments to date, you've tried your behavior modifications of increased exercise, low salt, low sugar diet, things like that, but the erections still aren't there for you, this is a great first line therapy. So men with like mild or moderate ED, they're going to have the best benefit from these medications. The knowledge that's a good place to start. So, and just see how they work for you. If they work, great. If they're not working, problem, we have to get the question, well, Viagra didn't work for me. Is it worth trying something like Cialis? And it is, because the different pills can have different responses in different men. And that's all based off of their genetics, receptors, things like that. So it's always worth trying a different type of medication even if you didn't have a good response from the first one. So the vacuum erectile device. So this is a hollow plastic tube that goes over the penis, and it's either a hand or battery pump, and it creates a vacuum suction that's going to pull the blood into the penis, cause the penis to become more firm. So once the erection is achieved, an elastic tension band can be placed at the base of the penis. This is otherwise colloquially known as a cock ring, and that holds the blood in the penis. And so you can maintain that erection for sexual activity. Now, I also recommend this for gentlemen that have noticed any change in length or girth of their penis, as this can be a great daily stretching activity, not just for sexual activity, but you would do a daily stretch where you put the penis in the tube, pull the penis on stretch with the vacuum device, let it relax after about 5 minutes. That helps pull good blood flow into the penis, gives the tissues a gentle stretch like yoga, achieves those two goals for helping maintain healthy erectile tissues and function. The number one tip here is if you are going to use it for sexual activity, do not leave the constriction band on for more than 30 minutes or fall asleep with it on the penis. It is technically a tourniquet, and this can result in severe damage. And so it's very important that you not leave it on too long, and definitely don't fall asleep with it on. It's quite effective. 68 to 80% of gentlemen found a benefit for their sexual activity. And then for penile stretches, I always recommend that if you're using this to help stretch the penis, regain some length, things like that, on the first day that you use it, put a little black marker on the top of the tube, and then once a week, put another black mark at the tip of the penis where it reaches, and then you could there have a gauge of the effectiveness of your exercises. So again, this is great for anyone that's noticed a change in size, to do their stretching exercises. And then for men that are just not getting a firm enough erection, if they're just using the pills or injections, which we'll talk about in a second, alone. So you would take your medication per usual. You would take your pill. You would help achieve an erection. And then you would use the vacuum device to pull a little bit extra blood into the penis and then place the constriction band on for your sexual activity. And then don't forget to take it off within 30 minutes and don't fall asleep with it. So the intraurethral suppository, otherwise known as Muse, it looks like a tic-tac, and it is put into the tip of the penis through this little applicator system that you can see here, and it is going to start to have an effect in about 5 to 10 minutes. It's important to keep this refrigerated. The success rates are lower, so 40 to 65% of gentlemen find success with this medication, and then most gentlemen don't end up continuing this medication for very long. The reason is that it actually has quite a few side effects in terms of burning and pain in the penis. It can also cause a low blood pressure and dizziness. And so this is, I will be honest, not something that I typically recommend just because of the side effects, and it can be quite expensive. So the most common reasons for discontinuation were insufficient erections, and then of course the pain and discomfort from the medication itself. So intracavernosal injection therapy, or ICI. So this is done by using a small diabetic needle, so the smallest needle that is created, and you do a self-inject medication directly into the side of the penis. And it goes into that body of the penis that we talked about earlier that helps cause the firmness of the erection, the corpora cavernosa. So your erection will have an onset within 15 to 20 minutes. Again, you still want to have that stimulation to the penis to help bring on the erection. The medicine alone is not going to just create the erection. You have to have that stimulation to help encourage the blood flow to achieve your best erection. So about 60% of gentlemen were satisfied and continued their daily or continued their use with this. Many men discontinued their therapy as they didn't like doing their injections, or they were having some pain at the site of the injection. It can also cause, in some gentlemen, some scar tissue to develop, which can cause curvature, which we talked a little bit about earlier, similar to Peyronie's disease. And the thing that we have to always watch out for and counsel gentlemen on is something called priapism, or an erection that's lasting more than 3 hours. So if an erection is lasting more than 3 hours, that is actually a medical emergency, and you need to go to the emergency room. At the emergency room, they'll give you a medication that helps reverse the erection to get the penis soft again. But the reason this is so important is that if you have an erection that's lasting too long, you're not getting that good blood flow or fresh oxygenation of the tissues in the penis, and it can cause permanent erectile damage. And so you do not want to wait more than 3 hours prior to going to the emergency room to get the medication that would help reverse the erection. Those were the most common reasons for discontinuation: pain, dislike of having to do with the injections, or it just wasn't working well. So men that use this therapy are most commonly men that are not achieving good success with taking the pills. And many men after prostate surgery will be on this medication for a short term, as it's very powerful. It can actually help with nerve recovery because it's helping increase the blood flow to the penis, and so that helps give good blood flow to the nerves and can help overall with the recovery of erections in the long run. And so we do use it as a therapeutic option for men after prostate surgery. And then men that should not use this therapy, anyone that's uncomfortable with needles. It's not really going to set the mood for you and or your partner if you're terrified of needles, and this is not a pleasant process for you to experience right before you're thinking of being intimate. Most men that try this therapy find that the injection process itself is much less intimidating than they originally thought. We go through it in the office the first time to show you how it's done, and that after that kind of initial shock is taken care of, most gentlemen feel completely comfortable doing this at home. The final thing that I want to talk about tonight in terms of treatment options is the penile implant. So the penile implant is a pair of cylinders that are inserted in the corpora cavernosa, or those erectile bodies that we talked about earlier. And then a pump that you control is in the scrotum, and it feels like a third testicle. And then the fluid that powers this device is in a reservoir, and that's placed in kind of behind the pubic bone in the lower abdomen. And the way this is cycled is that you squeeze the pump that's in the scrotum, as you can see here in this diagram, and that translates the fluid from the reservoir into the shaft of the penis where those cylinders are, and that creates the erection. To deflate the device, there's a small button here that removes the fluid from the cylinders and puts it back up into the reservoir, and then the penis is soft or flaccid looking as it usually would be. 98% of patients that underwent this procedure reported their erections to be excellent or satisfactory, and after 7 years, 94% of them were still in use and had not had to have any additional procedures. The most common side effects from this option were postoperative pain, mechanical malfunction can occur, and then for 1% of gentlemen, infection. So this is a video on how the penile implant looks and works in the body. So we're going to see here with the model provided, we can see the cylinders in the shaft of the penis. The gentleman is pumping the scrotal pump, which is translating the fluid from the reservoir into the shaft. That causes the erection. When he's done with his erection, he hits the release button, and this translates the fluid back from the penis into the reservoir, and then the penis goes flaccid or soft again to its normal appearance. A lot of common questions that I receive about penile implants. Gentlemen want to know if their sensation or orgasm will be the same. Yes, the penile nerves and what causes that sensation in your orgasm are completely separate from where this device is. And actually, if you're at the gym and you're undressed, no one can tell you have this device. The incision is about that big, so everything is put in through a very small incision, either just above the top of the penis or just below the penis on the scrotum, and everything's put in through there. And all of you stays you, meaning that there's no changes to your anatomy that occur. So nothing's removed, nothing's changed. This device is just simply slid in next to your natural anatomy and gives you that function that the blood flow otherwise would have been providing to your penis to help cause the erections. Many gentlemen ask me, will it make my penis bigger? It will not make your penis longer. The only technique we have to increase length of the penis is with that daily stretching activity we talked about with the vacuum erectile device. And that in itself is going to just regain some of the length that you might have lost from erectile dysfunction. It's not going to, if you used it when you were 20 years old and used it daily, it's not going to make that penis longer than it otherwise naturally would have been. It just can help you regain length. But the penile implant, so what we're talking about now, does not increase the penile length. It can, in some gentlemen, increase the penile girth, because when those cylinders expand, it causes an expansion radially or outward on the penis. And for some gentlemen, this increases their penile girth. So as I mentioned, can people tell that I have this? I've had gentlemen that have had partners for years that never knew that they had a penile implant. So it's at your discretion of who you tell, and it is completely non-visible from the outside of the body. You look just like you. Your penis will have a little bit more of a fullness to it, so you'll look a little bit more full in your flaccid state, but otherwise there's no physical difference that you would see. How often can you have an erection? As many times as you want within a day. If you wanted to have 5 erections in a day, it is your opportunity. You would just pump the device as we showed in the video and release it as such. How long the erection lasts? It's going to last until you hit the release button, which is important because it's different than your natural function. So when you climax naturally, your penis afterwards is going to get soft after climax. But with the penile implant, the penis will not get soft after you climax. The penis will stay just as erect until you hit that release button. So it's important to know that difference because it can be unexpected. The recovery time after surgery, I don't shy away from telling gentlemen that it's a very sensitive, obviously, area of the body. That first week, you will be sore. We'll help get you through that first week. The second week, you feel much more like yourself. We teach you how to cycle the penis to erection and back to flaccid, and then we get you back to sexual activity sometime between the 5th and 6th week after your procedure. And then how long does the penile implant last? The average is 8 to 12 years with the mechanical components of the device. At that 8 to 12 year time point, you would need potentially to have a new one placed. So that would be removal of the old one and have a placement of a new one. Now, I've seen these last 20 years and I've seen them last 2 years. Those are extremes and they're not very common. Just like cars, you can get a great one, and unfortunately, you could get a lemon. But again, those are at the far ends of the bell curve. And then the risks with surgery. So number one, you got to make sure you're safe for surgery. So seeing your primary care doctor, making sure there's no other risks for surgery like heart disease, uncontrolled diabetes, things like that. Making sure that if you're on a blood thinner, we talk about those things. So we go over all of those risks from the surgery standpoint. And then the one that we worry about anytime we do an implant in the body is risk of infection. So risk of infection for a penile implant is about 1 to 2%. So 1 to 2 guys out of 100 getting the surgery done are at risk for an infection. Should that occur, just like a hip or a knee or anything like that, you cannot leave the infected implant in the body. It has to be removed, the tissues washed, and a new one put in. So that's the one that we worry about the most, but thankfully it's a very rare complication. And who should get a penile implant? Really any man that's desiring spontaneity and reliability, especially when the pills and injections have not worked or are no longer working for you. You want to make sure that you're a safe surgical candidate by talking to your primary care doctor. And this can help preserve your existing penile length, but just to be clear, it cannot make the penis longer. It can help improve the girth, but just want to be clear that it cannot increase the length of the penis. So to wrap it all up, the best treatment for all of the things that we discussed tonight is going to be the one that you feel most comfortable with and what's going to help you achieve your sexual health goals. It's important to find a provider that's going to listen to you in terms of your questions and concerns and what your goals are to achieve these best outcomes. And then importantly, you're in control of your own health. So be an advocate for yourself, take care of yourself, make sure if you're having any of those early signs or you're concerned about heart disease that you bring it up with your primary care doctor. It really could save your life. And then if you would like to privately discuss your unique situations, we want to get you scheduled for a telehealth visit, and we'll get you plugged in with one of the erectile dysfunction specialists, and we'll get you started on your treatment pathway. So we have specialists kind of throughout the Maryland area. I have them listed here, moving from the north down to the south. And you'll see a variety of physicians that would be more than happy to help get you started down this pathway to helping you reach your sexual health goals. You can schedule your telehealth appointment tonight. All you have to do is you have to go to ChesapeakeUrology.com, and the first thing that you're going to see at the top of the screen is your telehealth video appointment, and it'll say schedule now. It's in a big banner right across the top. You can't miss it. And then you'll select your provider from that list that I showed you previously. And then you just pick a time and a date and you're all set. Any technology issues or anything else, we also have support staff that can help you navigate any of those issues. It's really quick and easy, and it's a one-on-one conversation about what your goals are and how we can best help you achieve that. So at this point, Lisa, I am ready to take any questions. Thank you all so much for tuning in and listening tonight for our first Chesapeake Urology webinar.
Great. Thank you so much, Dr. Mendez, for all this great information. We do have several questions. First one, someone would like to know a little bit more about diet and obesity as a risk factor.
Obesity in itself is a risk factor for erectile dysfunction. Gentlemen that have obesity are going to have higher rates of high blood pressure, high cholesterol, and diabetes, and heart disease and vascular disease as well. And so there's a tight correlation for gentlemen that are overweight or obese that's going to have more difficulty with achieving their erections. Also, from a physical standpoint, if there's a lot of abdominal fat or a fat pad that's kind of coming over the penis, it can make it more challenging, even if you are having erections, to achieve your sexual health goals. And so there's a lot of different things that we can talk about in terms of improving your cardiovascular health, your weight loss goals that will in turn also help achieve your sexual health goals. And most importantly, in terms of the diet, there's not a specific diet per se. It's not like I'd recommend, keto over whatever other diets you want to think about there. The main thing is if you limit your salt and limit your sugars, you're going to reduce your chances for high blood pressure, high cholesterol, and diabetes, and that overall is going to give you a better chance at health.
So the next question is, can you discuss the effects of BPH on erectile dysfunction?
The relationship between the prostate and the erections is a little bit, to be honest, we don't know all the details yet, but we do know for gentlemen that are having any type of pelvic pain, prostatitis type pain, pain if they've been sitting on a chair, kind of that feeling of sitting on a painful walnut, that type of thing. Those are all signs of pelvic irritation or pelvic nerve irritation. That can have negative effects on the erectile health and the erectile strength, because those erectile nerves actually also have to pass through the pelvic floor. And so you can have challenges with the erections there. For an enlarged prostate in itself, there's not a direct correlation to decreasing erectile function. Caveat to that is if you're on Flomax or finasteride, two medicines commonly used to treat BPH, you can have side effects from that medication that has sexual implications. So the tamsulosin or the Flomax can cause what's called a retrograde ejaculation or a dry ejaculate. You may notice that your volumes are a little bit less when you climax. In finasteride or Proscar medications, in 15% of men can actually cause a loss of libido, so a loss of interest in your sex drive. And so if you're experiencing those types of things and you're on those medications, talk to your urologist about that, and they can do some tweaks to your medications to help try and relieve some of those things.
So one gentleman wants to know if there's a difference between Viagra and sildenafil citrate.
So that's a great question. So Viagra is the name brand, and then sildenafil is the generic. And they are identical in their molecular structure, so they are the same medications. I will have a small caveat to that as well and say that there are men that have better responses to one versus the other. And it doesn't necessarily mean they respond better to Viagra. They may respond better to sildenafil. And it really just depends on how the manufacturer has made the medication. There can be very slight differences. And so sometimes gentlemen get their medications from pharmacies or compounding pharmacies. All of those are fine, but you can have slightly different responses to those medicines.
So another gentleman has a question about sildenafil interacting with Gleevec, 400 milligrams. He says his hematologist doesn't see an interaction with the brand Viagra, but wants to know about sildenafil.
So molecularly, because they are the same medicine, the sildenafil or Viagra, if they have comfort with one, it should translate to comfort with the other, as there's no molecular difference between the two medications. So it shouldn't be a barrier there, but I would defer to your hematologist in terms of what their ultimate recommendation was.
So the next question, a gentleman wants to know about any unhealthy side effects of Cialis and Viagra.
So the main side effects that you have to be concerned about is if you experience dizziness, sweating, or chest pain taking these medications. It's not the medication itself necessarily, but it can cause a decrease in your blood pressure. So if you have a sensitivity to decreased blood pressure, those are some things that can make it more apparent. And so for any gentleman that's having any type of chest pain with sexual activity or taking Viagra, Cialis, or any of those medications, immediately stop, tell your doctor, get an assessment for your heart and your cardiovascular profile. Other common side effects that are not dangerous but can be very bothersome are going to be headache, stuffy nose, stomach ache. Those will go away after you stop taking the medication. They can be quite bothersome, and a lot of times if we change your medicine, we can get you away from some of those side effects. And everyone, like I said, has different responses to the different medications. So one gentleman may have a headache with Viagra and not with Cialis. Maybe someone has stuffy nose with Cialis and not Viagra. It can vary across the board, so it's always worth talking with your doctor about any side effects you may experience.
Can you address the satisfaction levels with injections?
I'm going to read into that question a little bit. I'm going to guess that the question is that why is the satisfaction level lower than maybe would have been expected with the injection. So the satisfaction rate with the injections is about 60%. I think a lot of that goes into gentlemen just don't like to have to go through the process of, planning to do an injection. Most of the medication has to be kept in the fridge. You have to go, you have to get your needle, you got to drop your medication, you have to give yourself the injection, and then you wait for that time period. Now, I will say that the erection results with the injection medication are usually quite good. So the injection medication, because it is the most potent of the medications we have to offer, typically gives the best medication-induced erection that we can help you achieve. So I think that it's a combination of, either the pain, discomfort, or not liking to use needles, combined with the preparatory time, and maybe not so much the actual erection result.
So one gentleman wants to know, he's taking sildenafil. He's prescribed 50 milligrams a day. Can he take 25 milligrams earlier in the day and then the other 25 in the evening?
So it's a great question. So kind of the party line is that, we don't want you to double dose on medication. Now, that data normally comes from a gentleman that takes, let's say they took a 25 and then they didn't get a result an hour later, and so then they take another 25. We don't like those close dosings because it has a higher chance of dropping the blood pressure. As long as you're staying less than 100 milligrams in a total dose, as long as you have more than 8 hours between those two doses, specifically for a Viagra or Cialis, you're okay to take that second pill. But you got to be very careful. You don't want to take those two doses close together, because even if it's not that maximum of 100 milligrams, it could still drop your blood pressure if you're not used to that dose of the medication.
Okay, thank you. So we have one gentleman who says he's 57 and his libido is gone. He wants to know if you can address the libido issue.
There can be a lot of different things that can affect libido, your overall health, your stress and anxiety level, but important, your hormonal panel can really have an impact on your interest, your drive, things of that nature. And so for any gentleman that's coming in to see me, he may be having great erectile functions, but he may have trouble with his libido or interest. We do a hormonal panel to look at, his testosterone, estradiol, all these different things that can have an effect on that interest, that drive. And we assess if there's any deficiencies in any of those parameters. Having low testosterone does not necessarily mean you will have erectile dysfunction. And vice versa, if you have low testosterone and erectile dysfunction, it does not mean if we treat your low testosterone that you will have better erections. We do expect that it's going to improve your libido, but the testosterone does not directly have a close correlate with your blood flow and things of that nature. So it may not improve your erections, but it can definitely improve that interest, that drive. And I would definitely encourage any of you gentlemen to tune into Dr. Dave Fenig's talk on treatments for low testosterone and assessment for that, April 29th at 6:30.
Another gentleman has a question and says, after a night of lifting heavy weights, he notices that he has strong morning erections. Is this a clue? What does that mean?
If you have good physical activity, so if you've done a good cardiovascular workout, you've done a good heavy weights workout, you're going to have good blood flow to the tissues. You're going to have, during those times of increased weights and things like that, you're going to have a little bit temporary increase in your blood pressure, which can deliver a little bit more dilation and blood to the tissues. Not that we want high blood pressure, but it's something specific to weightlifting. You may notice that your erections are better the next day. And what this is really speaking to is you've done something beneficial to your cardiovascular system, your blood flow system, and your tissue system, and that can help improve those erections. It is a good sign that your body is having those responses, and it suggests that it staves away from erectile dysfunction. So definitely keep it up.
Another gentleman wants to know about any over-the-counter supplements that might make a difference if a person has mild ED. The internet and health stores are filled with lots of advertisements. What do you?
Absolutely. So that's a great question. I get that question a lot. Problem with the over-the-counter supplements and a lot of the advertisement that gets directed towards gentlemen is none of those things are actually tested or controlled. And so those companies can really put whatever they want into those medications. And a lot of times they're putting unsafe ingredients in there. Research that has been done, it's limited, but the research that's been done on those supplements varies across the board, but there's not a single supplement on its own that is thought to improve erectile function or penile health in general. And so while there's a bunch of things that you can get at the gas station or the health food store, any menagerie of these things, the problem with them, and I don't recommend them, is because they can put unsafe ingredients into those pills. And I've actually had, unfortunately, a couple gentlemen that have come in with liver dysfunction and some serious health consequences because of the ingredients that were put unknowingly into those supplements.
One gentleman says he notices that after he goes for a run, he's unable to achieve an erection after about 30 minutes. Is that normal?
So that is normal. So in the close proximity to your exercise time, you're increasing your sympathetic system. During the run, you're engaging kind of the recruitment of the blood to your core systems to help get it to the heart where it's going to be pumped throughout the body. But you might have some decrease in blood flow to organs such as the penis because that's not critical for the actual running state. And so for that immediately time point after either a strenuous physical activity, such as running, things like that, you may have trouble achieving your erection. But later on, after you've recovered from your activity and after your nervous system has kind of reset itself, you'll likely sense an improvement in your overall function. And some gentlemen report an increase in quality of their orgasm actually after physical activity.
We have a patient who's interested in the penile implant and is wondering if you might have other patients who've had the implant that they could talk to about the experience.
Absolutely. For myself, there's not a lot of surgeons actually that are trained specifically in kind of all the intricacies of the penile implant. And so I always recommend any gentleman thinking of proceeding with a penile implant or wanting to learn more, find two people to talk to. Number one is going to be a high volume penile implant surgeon. So myself, the other gentleman that I have listed on the slide that I showed before are all people that are specially trained for placement of penile prosthesis. You want to find someone that does a high volume of these cases per year because that's going to be really important for your outcomes. The second person you want to talk to, and I always recommend it, is another gentleman that has undergone the procedure because they're going to have the best perspective in terms of what to expect and what their experience has been. And so I have kind of a whole list of gentlemen that have undergone the procedure that are happy to share their experience. The best way to get that information is schedule a telehealth visit with me and we'll kind of talk about your goals and what you're thinking of, and then we can get you in touch with, I call them patient advocates or gentlemen that can help you with those questions that have undergone the procedure themselves.
Thank you, Dr. Mendez. That's all the questions that we have.
Fantastic. Well, thank you, Lisa, so much for your help tonight, and thank you to all the gentlemen that joined us this evening. And then I again encourage any of you to go to ChesapeakeUrology.com and you'll see that button right away that you can schedule your telehealth visit. So you can get one-on-one consultation to figure out what your goals are, and that can be with any of our ED specialists. We're all happy to see you, and especially since we all have a lot of time on our hands with being at home with restrictions, the visits take about 15 minutes, and we can really help get you started on your pathway. All right, so stay safe out there. Please don't hesitate to reach out to us if we can help you in any way.